This government meeting is brought to you by Eastworks and our local cable subscribers.
Okay, the meeting has been called to order. I'll do a roll call. When I call your name, please respond here. Tom Brown.
Here.
Patrick.
Here.
Leslie. She has excused absence. Catherine.
Here.
Crystal. No. Stan, no. Marie. Here. Louise. Here. And Kathy. All right, we have a quorum. We have 6 people here today.
So we just need to determine if Stan and Crystal had excused absences.
I haven't heard from either one of them. I did from Leslie. All right, we'll take a look at the minutes. Any questions, comments, additions, or deletions to the November minutes?
I make a motion to accept the minutes, November minutes.
I'll second it. Okay, Tom moved the motion to accept. Marie seconded. All in favor, raise your hand.
Aye.
Opposed?
I think I'm abstaining.
Okay, motion passes. Public speak. Is there anyone out there that would like to speak? It doesn't look like. Anyone here?
How many we have in our quorum?
6.
6.
So if one person doesn't vote, you only have 5 people voting
That's
yes of the 9, so then it still works.
You only need 6. You only need a quorum to open the meeting. Once the meeting is open, I think you're all set to do whatever business you want. So like if somebody had to leave now, the meeting's open with a quorum. I
But
think
it's not a majority vote. Well, we'll address that
It is-
later. We'll address that. Let's address that in our agenda item later.
okay.
Because that is a
I believe
question,
you're
a
okay
simple
once the meeting
majority.
is open.
Okay.
Once the meeting is open with a quorum, I think you're fine. If 5 people left, you only have 2 people left here. I think you're still okay to run the meeting. As
So-
long as
To run the
But,
meeting.
but if somebody, we'll go over later in our agenda item about voting and how it affects the quorum.
Okay, so we have no one for public speak. Patrick, Highland Valley.
I have nothing to add for this time.
Nothing to report. Thank you,
Nope.
Patrick.
We meet another week. Our meetings are off balance, so
Very good. We'll hear from you in January then. Great. Okay, the next order of business is the director's report.
Okay. So, hi, everybody. In the preparatory email you received the missing piece that we didn't have last time, which was the October fiscal report for the city funding, so that now you actually have the whole first quarter of July, August, September. We already went over it, but now you have it. And then the second piece that I sent was the June to June, so June 2023, I'm sorry, July 1, 2023 through June 30, 2024, final expense control report, which shows you the full fiscal year of 2024. So that was a missing piece I didn't have until recently. That shows you how much we spent in each of our city funded line items. And at the very bottom, it says that we were, so we spent 97.03 of 100% on the staff, and we spent 100% of our budget on building and equipment repair, and travel. So that leftover 2.97% unspent in staffing would go back to free cash. And then at the bottom, this might be confusing, where it says total group 4 voted capital $9,800. That's the money that was voted by city council for the ad hoc building committee's work, carried over into FY25 is when the expenditure will be. And that invoice will be paid in January, and then that, so then on FY25's expense control report, that will show as, being spent, but that's not sitting in the Council on Aging's account. It's a capital account, so it's a different account. So so the reason why I'm showing this to you is most importantly to show you how much went to free cash. And usually that is because of somebody leaves the center and somebody new joins and they're paid less, or there's a lag time in hiring, or it could be that the drivers didn't drive as many hours as the maximum, that sort of thing. Okay. So that, and then we don't have, so for the first 2 quarters, I'll be able to show you what we have expended so far on the various different activities and services that we do. I try to give you folks that twice a year. It's not all entered yet into the spreadsheet, but when it is, probably February, because we're trying to do these fiscal reports every other meeting. So in February, I'll be able to show you, here's what we've taken in so far in the donations accounts and grants, and here's what we have expended for our services, transportation activities, and so on. Any questions on that before I move on?
I just want to make sure I understand the first quarter report will be presented in February.
So the first quarter city fund has already been presented at our last meeting. I just didn't have the written down, the full, all 3, July, August, September written down, printed out, and that's what you got today. So we already talked about it last time.
February will be the first 2 quarters, I assume.
So February will be the first 2 quarters, just in terms of not the cities. So by February, I should have the second quarter of the city general fund and the first 2 quarters of the Council on Aging other accounts, expenditures and deposits. Louise has her hand raised, Kathy.
Hey, Louise?
How do I have my hand raised?
Guess not.
I guess not. That was my mistake.
I thought I heard it.
All right,
Okay.
no worries.
And then there was nothing else on the agenda that I warned ahead of time that the director would be discussing, I don't think. So we'll move on.
Very good. We'll move into old business. Is there anyone that would like to report on the new building ad hoc building committee, where we are?
I was hoping that Leslie, as the secretary of that, committee, would be able to make a report every time, but she's not here. Do one of you want to, or Patrick?
I think the only thing to update on is that we're nearing the end. The subcommittees have pretty much finished their work. They're compiling their reports. Reports, as you pointed out in an email, Cindy, are not coming from the subcommittee, but coming from the ad hoc committee to the mayor as part of that report. And we're just waiting for the UMass piece of this that I think is coming in January.
So we have the UMass. The latest is that we have UMass's draft, very rough draft. And the ad hoc committee agreed that the quote program committee, which Kathy and I are on, would review the draft on behalf of the subcommittee, since it's of the ad hoc committee, since it's in between meetings. We'll review it. UMass wants feedback. Did they capture what people said accurately? And did they represent us accurately? There's information in there from all their interviews with other similar sized communities, such as Situate, Wilbraham, a range of wealth of communities. So from Greenfield to Wilbraham sort of thing. Sorry to call you folks out. And then once we have reviewed that and given feedback, UMass will submit their final report. And the January 14th ad hoc committee will look at the UMass report in advance of the meeting individually. And then the final drafts of all the appendixes and the first draft of the executive summary, and look at it all as a final report and say yay, nay, or you have these 10 edits to make. And then we'll make the edits, and then it'll be ready in its final format. So in other words, any edits will be voted on January 14th. Then on January 28th, the final packet will be presented to the mayor by UMass and by the committee.
There was an email or notice or something came out either yesterday or today that January 14th meeting was canceled.
No, what they did was
Yeah, that was
they needed to create a new meeting, Google Meet calendar item so they could include January 28th. So I think that they canceled the old meeting invite and made a new meeting invite that's just January 14th and January
Okay.
28th, because we couldn't invite officially the mayor and UMass to
the other Google.
there was no January 28th extant Google Meet invite. So it should work for you all. Just use the same link you always use for both the 14th and the 28th. And the agenda for the 14th and the 28th will be coming out soon. And if you want to tell the public about coming to the 28th to hear the final report, we'll be in here. But, as many people as can fit online or in the room are welcome to come.
Good.
I see that Louise does
Yes,
actually have her
yes,
hand.
Louise?
Yes. I think I need to backtrack some from when I first put my hand up. So when you were talking about comparisons, Cindy, I didn't hear in the comparisons any comparison that might be more relevant, which would be by geographically, I suppose, like what we have access to, or seniors, which would be Holyoke, Springfield, Northampton.
So the comparisons were senior centers that were built over the last couple of years, so 2021-ish to 2024. What was the process they had to go through to build the center, and what do they wish had been done differently? This was not an assessment of what do they offer or what is in the building. It was simply building size, population size, average median income, things they wish had been done differently, and
Process.
and the process they went through with their town government. So it was not about programs and services that they offer.
No, I'm just trying to. We're talking about the UMass report, right?
Correct. The UMass report looked
Okay.
at towns that had a relatively similar population size. They looked at towns that had, in addition to having built recently, I can add, they were all over the state. It wasn't about neighboring towns. It was about it was about literally the process of building a new senior center.
Okay, so it had nothing to do with more pressing needs, which would have been better reflected by geographically closer.
The needs were strictly about what do Easthampton's residents say their needs are for growing older in Easthampton. So the report had two parts. What did the Easthampton residents who were invited, who came to the forums, the 3 forums we did, what did they say their needs were to grow older in Easthampton, number 1? And number 2, what did other senior center directors who have recently built say that they went through with the process. And what we're adding to it is, where do we think the building could go in Easthampton? Number one. And number two, what do we think the building should have in terms of space inside and outside to offer what we're offering now and what we think we might want to offer in the future for a building. So that's the work that the mayor gave the ad hoc building committee.
So it's missing, if I can, is participation first at all. By definition, I mean, more people are going to participate if they're seniors and if it's working for them, and fewer people who might have very different needs are going to be younger and therefore ignore any attempts to use up more hours in their building.
Okay, so I can piggyback on that. So two things. One is that people of all ages were invited to the forums through the school system and through the press, but we're not done. So once there's a official city council appointed building committee, the building committee will, and somebody else can correct me if I'm wrong, will have as part of their charge to talk to people who are in their 40s and 50s and on their way into becoming seniors who would use the center, and what do they want and what do they think about where it would go and what do they think about how we would pay for it, and maybe even people younger than that. So yes. And then the other thing that was included was a look at how many people is it best practice to build for per day. So parking was one of the key things looked at when looking at other communities, which is how much parking did they have and was it sufficient, given that the ad hoc committee said this is going to be a senior center that most people will drive to, given the history of Easthampton's use of the senior center, and also looking at public transportation and the access to the senior center physically from the street. So that was looked at because that will influence where it goes. So anybody else from the committee want to say anything?
I would just chime in that our final report to the mayor is a preliminary report, for lack of a better word, for the future building committee. They may totally, so we've identified 6 potential sites for the senior center. They may come up with 6 more. They may come up with 6 different ones. They may expand on some of the public input attempts that we've made. This is this is going to be labeled our final report, if you will, that we hand to the mayor. It's a stepping off point for the future building committee. They may take our report and love it and say it's all encompassing. They don't have much more to do. I'm guessing that won't happen, that they will be looking at expanding on that. So this is only the first step in several steps that will happen in the coming year.
In the process of, from the building perspectives, building committees point of view, right?
Correct.
So one of the first tasks of a building committee is going to be to write a request for an RFP to hire the professional expertise they would need to evaluate the different sites and figure out what would the general design of the building be. And so we, by doing this work, hopefully influence what would go in that RFP.
The RFP, though, that's going to be sort of fairly non-representative. I mean, the process so far works for a building committee, but not for any other aspect of the senior center.
I'm not sure I follow that, Louise, but I guess all I can say is that the building committee is going to be charged with selecting a designer, selecting an architect.
Yeah.
And throw everything against the wall that we've thrown in that we want to see in a senior center. And then if that price tag doesn't make anybody pass out, that's what they continue to work with. If the project is estimated to come in at 18 million and throwing everything against the wall comes in at 30 million, Well, guess what? We've reached for the stars and we need to come back and only reach for the moon. So it's a process. It's a beginning of a process. It's by no means the end of the process. It's a very, very beginning. Even though this ad hoc committee has worked on this for a year, it's the very beginning of the process to hopefully give the building committee a point to hit the ground running with their work.
For example, if the ad hoc committee says, we all think the building should be 1 story and not 2 stories, and here's why. And then the building committee, what comes out of that is a very strong result for a 2-story building, and they go in another direction, then probably this board, which will get a copy of the ad hoc committee's report, and this board can, before the building committee even gets appointed, this board can look at the report and this board can discuss it and can say, as the COA advisory board, we want to take a vote or not take a vote on what we recommend go into that RFP. I mean, that is a possibility. Just like the Commission on Disabilities could probably say, if there's going to be a new senior center, here's what we think should be in a new senior center, and write a letter to the mayor. So anybody can
That's
contribute.
right, joint. So the Commission on Disabilities could, at what point? Can you just repeat yourself, Cindy?
I'm saying at any point in the process, any other city board, or as I understand it, I could be wrong, any other city board or committee, body, the public, individuals can write to the mayor or go to city council public speak or come to the council on aging public speak and say, here's what I think about a new senior center. And that is entered into the public record and considered as well.
And from my experience on the,
Wait, I'm trying to just jot down actionable things. And the one that I'm most impacted, Stan's not here, is we're the only 2 joint members of Commission of Disabilities, on disabilities. That's where my ears picked up. And I'm trying to figure out the first possibility for disabilities representatives to have an impact on the whole process.
I think, Louise, that possibility of input is anywhere along the way, as Cindy was saying, public forums or coming to meetings, what have you. Your input is anywhere along the way, but keep in mind.
Your meetings, not going to be a majority. You don't want, by virtue of being a Commission on Disabilities, they're forever trying to be representative and forever lacking.
Keep in mind, we're gonna have architects and designers that understand what's required and what's needed to meet disability.
That's not what I'm talking about. I'm talking about when would we, I mean, public speak is unlikely. The mayor, quite honestly, is checked out at this point.
Yeah, we can't speak for what the building committee will do. Where I was gonna go before, though, was what we have to trust as a board, and from my experience on the 2 school building committees, is that the director of the COA and possibly 2 or 3 members of this board will be sitting on that building committee. And that's what keeps the committee within the guardrails. So for example, on a new school, when someone said we should do this, the superintendent could speak up and say, what are you, nuts? We can't do that for whatever reason. So Cindy and 2 or 3 sitting board members will be on the building committee. That keeps them on the straight and narrow.
Yeah, but that still doesn't answer what I'm trying to figure out, which is where the Commission on Disability is capable of having input.
We can't, that's up to the building committee, Louise.
Yeah.
That's up to the building committee, not us.
And Patrick has his hand up. I'd like to give him an opportunity. Patrick?
I can answer your question, Louise. We're just the first step in any of this. So what you're looking for is when you can give, when you and the commission and everybody else can give their input as to what is going to happen. That is a couple of steps ahead of where we are now. So I think to simply,
Years.
Let him
sim-
finish, please.
could be, my guess is probably months, if not, it's, we were tasked with just, kind of giving the what we would like. And then the mayor is going to take that and use that and start a building committee. Until she does that, until that process comes up, once that is done, that's when all the input from the community, from the council, the commission of disabilities, the residents, all of that will happen. It's several months, if not years away. You know what I'm saying? I hope that helped.
Yeah, and if I didn't get it all down, I'll ask you private.
Absolutely. I can help you with that. Absolutely.
Okay. Very good. Thank you all for that report.
You're welcome.
Should we move since Ashley's
Yep,
here?
yep.
Okay, we're going to jump ahead here. We'll come back to the board bylaws and we'll move to new business as Ashley is present and is going to make a presentation on Shine.
Welcome, Ashley. Ashley Fraga is Fraga or Fraga?
Fraga.
Ashley Fraga is our outreach coordinator and our only resident Shine counselor.
So, Shine was booming, this Medicare open enrollment. There were a lot of changes made to prescription drugs. So we had a lot of people doing checkups, which was recommended. We put everything out in our newsletter to, come on in and get your Medicare looked at, see where you are and where you can go moving forward. Rough numbers, I touched base with about 180 people. It's probably a little bit more as I continue to go through everything and do everything, but I'll have good numbers by January when we have our Shine meeting and we get those numbers.
So that's December 7th through
October 15th through December 7th.
there you go.
So if December 7th is a cutoff, why am I still seeing all these stupid commercials on television trying to get me to switch plans?
We have Medicare Advantage open enrollment January 1st to March 31st. So that's for the folks that are in current Medicare Advantage plans that can change and want to change them,
And that's different of what happened from October to December 7th.
which is general open or Medicare open enrollment. Then the next is also considered general open enrollment. But those two periods are usually, but there's also another level called special enrollment periods, which is a whole nother layer of,
So it sounds like you can enroll or change 365 days a year.
depending.
Yeah.
Yep, depending. So, Shine is definitely something that is all year round, and I'm still having appointments. We're still trying to reach that target audience too, especially that are turning 65 every year, to come in for their Medicare 101, as we have Lorraine, the Shine Regional Director, come out and do a presentation. We've had the last 2 years really good numbers, a lot of new folks that are turning 65 coming in and doing the classes. We also had a representative from Blue Cross Blue Shield to host another difference between Medigap and Medicare Advantage, where that's a lot of where people have questions about what coverage, how they should utilize their Medicare. So we had a really good Medicare open enrollment this season.
Do you want to talk about what was different about this year from any other year in relation to what Medicare did and why there were so many more people who were freaking out?
Yes. So Medicare made the out-of-pocket for prescription drug cost at $2,000. So no matter what your prescription was, it was capped at $2,000, which was a great win for folks who take, high-tier drugs. However, there were increases to a lot of the premiums and a lot of the prescription drug plans, which had to offset some of what pharmaceuticals are going to lose. So that was a really big driving force for the numbers this year, especially whenever there's a change like that. a lot of folks either need to be kind of walked through it. And there was also the Medicare prescription payment plan, which is also something new that folks can enroll in, which spreads those co-payments out throughout the whole year versus that big lump. So there's a lot of changes within Medicare.
So I want to ask you what I hope will come across as a general question and not about me. If it's about me, I apologize, but I'm trying to make this general. So when I have my plan and they give me a card, say Health New England, and they say, put away your Medicare card, you don't need it. Whenever you go for anything, here's your Health New England card. What is Medicare doing for me in return for the money they're taking out of my Social Security every month?
80% of your medical coverage and hospital coverage.
Is Medicare, even though I'm only showing my Health New England card.
Which is 100%. That's like a combination of your primary Medicare and a secondary.
So when a person pays a bill with their Health New England card, Health New England submitting 80% of that to Medicare?
Or Medicare takes 80% of that cost, and whatever's left over is what gets charged to your insurance. You're essentially covering that gap.
I'll sleep much better tonight knowing that my Medicare is doing something for me.
After the deductible.
Yes, of course.
Yeah.
But it also gets complicated depending on which plan you're in. So if you're in a gap policy with a prescription drug plan, your co-payments are going to look a lot different than someone who's in a Medicare Advantage policy. And then you throw Medicaid into the mix, and then there's a whole different, lots of layers, lots of changes. And then, of course, the premiums did go up along with the deductibles for both Part A and Part B and the Part B premium.
Can you, for the total novice, say what is Part A and what is Part B?
So Part A is your hospital coverage. Anytime you get admitted into the hospital, anything that happens within the hospital. Part B is your medical coverage. So anything that happens in a doctor's office.
Inpatient is A, outpatient is B.
Mm-hmm.
And wasn't there a change to the Social Security amount that people get paid in tandem with the changes to Medicare?
There wasn't a
Or at the
immediate
same
increase.
time? Wasn't there recently an increase to Social Security, but then there was an increase to the amount that was taken from your Social Security check?
Part premium did go up. It will go up as of January
Can you
2025.
So can you explain that?
The increase?
Yeah.
It's going, so it's currently 174.60 or 170, I believe it's 174.60. January 2025, it will go up to 185 even.
But
And
that is,
2 years ago it was 164.
Exactly.
So it's quite a jump in 2 years.
It is.
but that's the bottom tier. Then it's based on income. It goes higher.
Correct. Anybody that made over a certain dollar amount, I believe, 203,000 for a married couple, 103,000 for a single person. You're looked at differently, and then your Part B premium is higher.
The part that, and there's nothing we can do about it or anybody can do about it, it's the government at its best. If my Social Security income could be $50,000 a year. And you're living on that plus a pension, let's say. If you have other income like stock sales or real estate capital gains or what have you, that sends that payment through the roof because it shows up as income, even though you're still living on the $50,000 a year.
Right.
Your payment goes through the roof. Not that this happened to me. I'm just saying, I know friends of mine that have had their payment go from 174 to 350 out of Social Security because they sold property and had realized capital gains.
A lot
Ashley,
of things that come in.
Ashley, can you, before Louise asks her question, just so you can keep going with your presentation, I'm asking you some questions just to prompt you. So can you talk about when we at the Council on Aging say, come on in and get a benefits counseling or a benefits checkup? Does that include Shine counseling? Or if somebody's calling and just saying, you know, I want to look at everything, would that be more than one appointment if they also have a Shine question?
I think it depends. I think for a benefits checkup, just an overall, I think it's really good to just get them in there and go over everything, have them bring up everything they possibly can, especially income and whatever they have, just to kind of check off everything that they're not going to be able to get. And just see what's available. There are a lot of things that don't count necessarily for the 65 and up population when it comes to SNAP, or things that get taken into consideration. So I think it's important to bring everything, because I can usually I can tackle everything within that 1 hour. And if we have to if it's a little bit more in depth when it comes to the Shine part, it's just a second appointment to bring them back in and go over more in depth.
I have a question. In order to facilitate, let's say the appointment itself, do you have a handout that gives them like the criteria they need to bring in?
Yeah, depending on what it is that we're looking for, or like what it is, our specific topic that they want the information on, yes.
So like fuel assistance, I know there's like 20 items per
Mhm.
tax.
I have that
one
list
has to
ready. I
bring
have
in.
a housing list of things that's needed if you're applying for Medicaid, or if you want to see if you're eligible for those benefits as well.
Fabulous.
And then there's a new system at the senior center for requesting an appointment with Ashley, which is very important, because that's where we find out what it is that you want to come in for, and where even the front desk can tell you what you need to bring in, or if you're there in person, give you the sheet. So what you do is you call the front desk, you press 0 when you call the phone number, you tell them what you want, and they will figure out, okay, they need an appointment with Ashley, and they will put in a request to Ashley for the appointment, just like when you call for a ride. That's your opportunity to tell us a lot of things briefly about yourself that she needs to know. She needs to know your age, so she knows ahead of time what you qualify for. We need to know if you're already a member, because then when you come and meet with her, she can talk with you about membership and what that involves. So please do call the front desk, even if you already have Ashley's direct phone number or extension and her email address. She will respond to you directly if you reach out. But we're trying to retrain everybody to call the front desk like you do with everything, because it's our opportunity to help you get ready for that appointment and make the most of it. And also because Ashley's just one person, it helps her work more efficiently. Would you say
Yeah.
it's helpful? I mean, if
Yeah.
it turns out it's not helpful, we'll change it back so that everybody just calls her directly, but we're trying this for a while. Okay, that's all I had to add.
You take questions, Jeff?
Yeah.
Okay, Louise?
Yeah. Okay, trying to backtrack again. With Ashley, the only, I mean, access to her is like, for me, as a senior center user, as a senior, is the only thing I'm left with. And she's absolutely incredible. I mean, she's already on Zoom if I don't make it and all that. Direct question to Ashley, which there's probably other people stuck like me. Do I go for a benefits checkup now, or do I wait for tax season? Because I think the help there, you have to start signing up very early, like in January.
No, you can get a benefits checkup whenever.
Okay, so I'll leave that for the moment. But what about if that's going to overlap with tax preparedness, my own or anybody's?
It shouldn't affect either.
Okay, so I've just added to your workload.
That's okay.
No, so the AARP Tax Aid Program is a program that the senior center signs people up to meet with the trained AARP volunteers. We have time slots for that. We're facilitating this AARP program so that people can get free tax help. People who are at any income level can come in and do that, and it has nothing to do with our outreach program unless you need some type of accommodation to help you participate in that program. Like you there's no way, you have nobody who can help you find all of your papers and you're in a complete confusion about it, you can make an appointment with Ashley. She can go to your home and help you find your papers. You know, I mean, or if you need translation services, Ashley can call UMass and find somebody to provide that translation service if AARP doesn't offer it. So yes, we support the tax aid program, but it has nothing to do with your benefits counseling checkup.
Great.
I know you need to go, but is there anything else you want to say to people about Shine?
Nope, just continue to give me a call and stay up to date and just be aware of the changes that are happening. But if you're not, come and see me.
And if you think you might have a card somewhere that you're not using, please call Ashley right away, because we found out that people had coverage that they had forgotten about or didn't know and were paying for, and they weren't even using it.
Wait,
They-
which card?
They send you a card that looks like a MasterCard, and it looks like, from the provider, it looks like somebody's trying to sell you a credit card, and it's actually a card with your benefits on it, additional benefits,
Additional
debit
benefits, yeah.
card.
or it looks like a credit card.
You get that from where?
I got mine from Health New England, but you get it in the mail, it looks, here's another credit card,
okay.
so you put it aside.
No,
Then you
usually,
find
yeah.
out there's $500 of benefits on that card.
Oh,
Mhm.
They
okay,
have to be
okay.
used by 12/31. They'll reload for next year, but it looks like a credit card and you put it aside.
I don't have that, yeah.
Yeah,
And-
that depends on whatever.
Right.
And if you want to use that to pay for a fitness membership at the senior center, you have to look at the back or at your paperwork and find out how to submit to that company a
Mhm.
waiver to allow that company to pay the city of Easthampton by check for your membership, because we don't take those cards at the senior center, just so you know.
But also I know that a lot of them have paper applications for reimbursement, and I can also assist.
So just a question for the director. So Ashley's one person and we have a growing senior population. She took care of 180 people apparently in that time frame from October to December. At what point do we need two Ashleys?
Well, we transitioned off having 1 point something Ashleys. And this is our first cycle of going through all the different times of the year with one Ashley, and we will reassess. But we do suspect that at some point we might need the Shine headquarters in Greenfield to help us recruit somebody to train just for that open enrollment period. In the other towns, for example, they don't handle out-of-towners with their paid staff. They use the volunteer trained Shine counselors to handle the out-of-towners that come, whereas we will, like, if you show up, we'll try to help you. So that would be the difference there. And then because we're going to become a certified application counselor for Mass Health, we're also going to see, because Ashley will have extra training and paperwork to do for that, how that will work. But in the end, some of the things that seem like extras that Ashley is going to do will be more efficient, because we'll be able to get in on the back end. And some of what takes a lot of time is all the dithering. So if Ashley can more efficiently, just like the way the veterans agent can get in the back end of the veterans benefit system, do that, it might be helpful. But once the population of Easthampton has not grown in many, many, many years, but the
it's aging.
seniors are growing. So we'll see how that impact happens. And then also, just so this board already knows this, but the outreach staff were doing other work. They were sitting at the reception desk and they were working on activities because they didn't have enough clients.
Mm.
So we have, we're gonna give that to the new activity coordinator. And as much as Ashley is highly experienced with activities and loves them, we're gonna be focusing on the work that nobody else at the center besides me can do. And I can't even do Shine. I'm not a certified Shine counselor. Brendan, the former director, was a certified Shine counselor. So really they had 2.5 Shine counselors. So we'll see. It's a work in progress. You can go.
Okay.
Thank you.
Thank you, Ashley.
Thank you, Ashley.
Thank you.
All right, so.
All righty.
I
To old business, and we following up with, something that was sent with our attachments was on, how to vote yes, no, or abstentions and what that really means. And, so we need to take a look at that abstention, because, you know, after a couple meetings ago, I just noticed that something to discuss is also what a quorum means. You know, we have 9 members on the board, so a quorum would be 6. That's 2/3 of the people. And then, so we have the quorum, but then what is passed by simple majority? And it says typically that's in the bylaws, and I didn't see that in our bylaws, anything about voting, but maybe the city of Easthampton has something more broad for all.
Yeah.
Cindy.
So I do have that. So Barbara LeBombard, city clerk. If a majority is 6 votes, which is, in our case, so let me explain this. A city board or committee vote means that a simple majority of the quorum, not a simple majority of the number of people present, must vote yes to win a decision, even something as simple as approving the minutes. And so,
Cindy, jump off for a moment.
yeah,
A majority of the quorum, not a majority of the board.
a majority of the quorum is always set.
Right.
It's not a majority of the quorum present, is what she's saying. It's a majority of the,
What you just read was a majority of the quorum, and a quorum is only 6. So all we need is 4 of 6 to pass something.
okay.
It's
So,
the way I read it.
but let me tell you what Barbara said about that.
Okay.
She said, if a majority is 6 votes and 1 person abstains, it will not pass, because then only 5 yeses out of the 9 is what she's. So
That still
this
doesn't
needs to be
explain simple versus
clarified.
Quorum. Yeah.
So this is what I wrote to her to ask. Is it accurate that a city board or committee vote means that a simple majority of the quorum must vote yes to win a decision, where quorum equals a majority of the full complement of members of a multiple member body? So with the 9-seat COA board, for something to pass a board vote, you need 6 yeses. If only 6 members are present and there is 1 abstention, it does not pass. Therefore, even though an abstention is still not counted as a vote cast, because abstentions are not counted as votes cast, it effectively acts as a no vote, because the basis for a majority is a fixed number, and she said that would be correct. So it's not what you're saying. What it is in the restaurant lingo where we say it's 6 all day, it's 5 all day. So it's 5 actual yeses, not no's or abstentions, means that it doesn't pass.
But a
because-
majority isn't 6 votes. A majority is 5. And a quorum is 6, but a majority of a 9-member board is 5.
So then what we need to know is, so
You can't mix, we can't
I know what you're saying.
mix quorum and
I
majority.
know what you're saying, but but what I asked her was, with the 9-seat COA board, for something to pass a board vote, you need 6 yeses. And she's saying yes.
I'm not buying it.
You're not buying it. So we just need to clarify that.
Yeah.
And the reason why I asked Barbara is Kathy can explain.
Yeah, we asked because we had some abstentions, and I was concerned whether the motion was being voted upon
Right.
and passing or not. And I know that with the clarification I think that needs to come is what we vote on, what needs to be a quorum and what can be a simple majority.
It's always been my impression that you only need a quorum to open a meeting.
Okay.
Once you've opened the meeting, now you need a majority of the members present to vote something through. So a quorum is 6. We have 6 people. I need a majority of that 6. Maybe I'm saying what you said, Cindy. I need a majority of that 6 to pass a vote. So it's got to pass at least 4-2.
Right.
At a
Right.
minimum.
Mhm.
I don't know how an abstention affects that. So if,
Abstention is a no, it doesn't count no or yes.
Right,
It's
so-
just a no vote.
right, so then the majority becomes 5, because if I go 4 1 and 1. I have 4 in favor, 1 opposed, 1 abstention. That motion should pass.
This is exactly what happened when we approved the minutes from November. We had a quorum of 6 today, 5 voted yay, and we had 1 abstention to approve the
So we had a
minutes.
majority of the quorum, a majority of the present
Right.
passed it.
But if it turns out that it is a majority of the full board that counts, then the minutes did not pass because you would need 6 yeses.
Yeah.
Right.
Yeah.
And so that's what we have to
And I
clarify.
can't-
And I don't think that, yeah, I think that would be a simple majority there, like the quorum or the 2/3 majority. Like if we want to change something, amend the Constitution, I mean, not the Constitution, yes, the bylaws, we would have to have a 2/3 majority
Correct.
of the quorum.
Correct.
But for the other voting that we do, I think it's a simple majority, but we have to get clarification on that.
And then, so the reason why Kathy sent out the Roberts Rules of Order on abstentions, and also after that, I did some research based on Roberts Rules of Order, was to explain also what's involved in an abstention and
Yes.
so can you go over that, Kathy?
Sure.
Now I'm facilitating you, but you're the chair.
Right, yeah,
So
thank you.
you're presenting, so I'll
Yes.
facilitate for a minute.
So basically an abstention and you received this document, about why, if somebody is abstaining, and there is supposed to be some sound reason. You don't just abstain to abstain. You should have some reasoning. In this document, it gave you 6 common reasons for a person abstaining and everything. And it is our responsibility as board members to represent the board and represent the people and vote, as appropriate and so forth. I'm not sure I'm explaining myself right or not, but it is a duty and it is a privilege for us to vote. And I think it is very important that we have, good reason for abstaining. I know I abstained because I don't know if this is really accurate that I did not vote for myself when you nominated me as chair last week, because I thought that, well, it's conflict of interest. I don't really vote for myself. And Leslie did the same thing. And so,
Sorry, I think I was the other person who abstained.
yes, you are. Yep.
Wait, but we can open for questions in a minute. Kathy's still presenting.
Yes, and so I mean, the reasons for a member to abstain, and you can do a couple of things with this in the minutes. You can say who, the first thing I have done in my past meetings, if somebody abstains, you list the person abstained. And it is up to the board if they want to know why somebody abstains. You can certainly, anybody on the board can ask someone why they abstained. But then the reasons are, you can read their conflict of interest, a fear of having if you're a minority opinion or something and you feel uncomfortable voting, or if you disagree with other board members, internal conflict on an interest or on an issue. It's another reason that a person cannot vote, or if they don't feel that they have enough information to make an accurate decision, or just lack of focus. They're not really focusing on what's happening in the board and so forth.
I guess I can't disagree with Robert's rules, but man, number 2 and number 3 seem like a cop out.
Yeah.
I have a dissenting opinion, and I don't want you to let you know I have that, so I'm going to abstain.
Right.
That is crazy 101.
Mhm.
Or disagreeing with if I disagree with you, I'm going to tell you I disagree. I'm going to vote no.
Yeah, we would hope we're an
Abstaining
open
on the
board like that.
2 and 3, I don't know where those came from. I've never heard of them in my life.
No, this is oh, sorry.
Go ahead.
This was an article
Yes.
on what are people's reasons for abstaining. It was not what is appropriate to
Right.
do on a board. This is just saying, here's what people tend to do in life when they're at a meeting.
Okay.
It's not saying whether that's right or
Right.
wrong.
It was my understanding that that was wrong, that you vote yes or no unless you have a conflict of interest, or you don't know enough have enough
The issue.
information, or what have you. But you shouldn't abstain because you want to avoid voting yes or no.
Conflict. Yeah, right.
If you have no other conflict and you just simply want to cop out because I don't want to tell you that I dissent from this, man up, and vote no. Vote no if you want to vote no, but you shouldn't abstain just for the sake of abstaining. Thank you for clarifying that, though, because I thought those were the rules.
No, just reasons,
Reasons.
why, the most common reasons why people have
Kathy, what were the, no, 2 and 3, 4 and 5?
Well, you got them in the email, Louise.
Yeah, did you get the email? Cindy sent it out earlier, a conflict of interest, and these are just reasons. It doesn't mean they're good reasons, and I would hope that we as a board are open enough and that we will be open with one another and say, you know what, I disagree with that, and this is why,
And
and
vote
so
no.
forth, and vote no, yeah. Because it could get us into difficulty at some point in time when we really have an important issue to vote upon, and someone, just continues or, I don't know that we have anyone like that, but they continue to abstain, and then that defeats our purpose as a board of trying to do good work.
No, okay, so I agree with that, but I'm still struggling with my own decision today, which was,
To abstain the minutes, yeah.
yeah, rather than to vote no. And it seemed less injurious because I was unprepared I didn't have to myself sufficient reason, convincing reason in about 2 seconds to vote no. So I just abstained.
Did you have a convincing reason to not vote yes
Oh, yeah.
on the minutes?
Yeah. This has been an ongoing problem for some time, and
With
I
the
don't
minute-
think, I don't think we want to
minute-
get into it now.
I
Sorry.
don't want to go down this rabbit hole, Louise, but the minutes are simply a recap of what was done at the meeting. You either agree with you agree that the minutes are a reflection of what was done at the meeting or wasn't.
Yeah, it's not that simple.
It's like
And
a
that's
thing-
why we have open comments,
Right. So if you disagree with the way something was handled at the meeting, you would disagree with that at the meeting. That disagreement would be noted in the minutes. But the minutes is simply a snapshot of what happened at the meeting. I'm not sure.
Okay, I've had trouble with the minutes for some time.
Okay. But
How they reflect the
But
meeting.
the primary reason I think to abstain from the minutes is if you weren't at the meeting. That's the only reason I've ever seen anyone abstain. You
Yeah,
vote
me
yes or no.
So when we are taking a vote on the minutes, that's the moment when you would say, this is not an accurate reflection of the November 14th meeting. I think what we said was, let's just give an example. Let's just say at the November 14th meeting, we said the senior center is going to be open from 8 to 6 from December through January. And then you would say, that's not what was decided. What was decided was the senior center would be open from 8 to 5 in December through January. And then you would say, it's wrong, and it's a wrong reflection of the discussion. We actually said till 5, we didn't say till 6. Then that's the opportunity for the secretary to say, oh, okay, I see that. Then the board would take a vote. This needs to be edited, amended. And then that's giving the secretary the direction to, if it passes the vote, to go ahead and change it to the new wording, because the board's only function, correct me if I'm wrong, in reviewing the minutes before passing them is to say, these are an accurate reflection of what we discussed. But if you just don't like some aspect of what we discussed, or that's, if you take issue with something that doesn't have to do with, is it a reflection of the minutes, you can request that the chair put a future agenda item on, just to say, I want to reopen that conversation.
I could.
Sorry, before I lose this track of thought to Cindy, what do I do if I've got, I've read the minutes, assume, and something about them confuses me, so they're inadequate.
Do you mean that there isn't enough detail in them to explain something to make you feel like you can say it was an accurate reflection of the meeting?
Yeah, sort of.
The minutes do not contain the full detail. The minutes are a record of who was present, what were the decisions that were made, what was the general topic of discussion. If you want the absolute details, you would have to rewatch the meeting or read the transcript.
Now, the minutes are not going to be verbatim.
No,
And
I know that, but, like you had 1, 2, 3 in parentheses after votes in the last one.
Oh, we have the abstentions in there. Yep.
Yeah, and I saw somewhere, but I mean, I couldn't place myself.
Meaning you couldn't place where you voted, because that's not going to be reflected on there.
No, I couldn't even place how many no's, how many yeses, and how many abstentions.
So that's a fair thing. You can absolutely bring up when we ask, is there any discussion about the minutes that we just talked about? And if you say, listen, it looks like we voted on question 2, whatever it is, and it says here 1, 2, and 3. So that's usually a first, second. I'm assuming maybe that means the first, second, and then the vote.
601.
But if you want to know what the vote count is, that's totally a fair question. Was this,
Well,
everybody? Is that what you mean? Or
Yeah, sort of, yeah.
okay, yeah, that's a very fair
I
question.
didn't know
To
how
ask.
to vote because it seems to me
Time to bring that up, Louise, would be when I say,
Yeah,
we'll take
Any
the time for
questions?
the minutes. Are there any questions or
Yeah.
comments or edits or deletions? That would
before
be,
yeah.
yes,
okay.
before we vote. And I opened up the minutes with that, about any comments or anything. And that would be the time, Louise, before we actually make the motion.
and
You're
So-
up.
I'm looking at here, thank you, Sean. The 601, it simply means 6 were in favor, 0 opposed, and 1 abstention, and it's got Louise's name in parentheses as the one that abstained.
Mhm.
I think that's pretty clear. You don't have to say who voted in favor. There were 6 in favor, none against, and 1 abstention.
You do have to say who abstained.
Right.
Yes.
Yes, so that's
Which
why it's written that
I
way.
learned, when I was reading over Robert's Rules of Orders, and that's why I put it in.
And just to follow up on one point you made, Cindy, that let's say you present the minutes for approval
Mhm.
and somebody points out a correction, as you
Yeah.
said. I could then say, I'm making a motion to approve the minutes with that correction.
Yes.
Then you go back and change that
And we've done
and they
that.
still get approved. We don't hold up the approval. You
Correct.
can go back and make the correction later on.
So the gist, though, is as a responsible board member, each member needs to educate themselves about the issues the board is discussing and ask for help if they don't understand. They need to come prepared to vote if on the agenda we're warning that there's going to be a vote. And they should only abstain if they have a quote, good reason. And they even have the opportunity to say why they're abstaining, like I was absent. And if somebody does not ever vote or hardly ever votes, yes or no, then they're not a fully participating member because if there are important issues and they always abstain, they're demonstrating that they are not an active member. They're not reviewing the materials. They're not educating themselves and coming prepared to vote, or they're not taking a stand at the meeting and saying why they are confused or they can't vote yes or no. So
Kathy,
that's,
if I might one,
Okay, so, my intervention would be, when Kathy opens the minute, us for approval of the minutes, to get in right there and ask questions or make
Correct.
comments.
That would
Okay,
be the time, yes.
Yeah.
before we're having to vote.
You got it.
absolutely.
and just, we have to go, but just to piggyback on what Cindy was saying, I could be vehemently opposed to an issue and I vote no. But when the minutes come around, I'm obligated to approve the minutes. They reflect my no vote. Even though I didn't like the issue and the way it passed, I'm approving the minutes because that was a recap of what happened at the meeting. I'll make a motion to adjourn. That was quick.
Yeah.
I'm opposed.
voting.
Okay, all in favor?
No.
Ian?
Yes, I'm just kidding.
Very good.
Oh, there was a vote.
6-0.
This government meeting is brought to you by Eastworks and our local cable subscribers.